Yeah, Spyglass is a new camera that's been developed that allows us to view the bile ducts and the pancreas ducts directly to look for pancreas cancers, cancers that arise from the bile ducts or have spread to other areas. It also can allow us to identify indeterminate things that aren't well identified on CAT scans or other imaging that can give us direct visualization. We use Spyglass when we suspect that there's a tumor. So based on imaging such as CAT scans, the patient's clinical presentation, their laboratory values, if there's a potential that there's a tumor of the bile ducts called a cholangiocarcinoma or a pancreatic tumor, pancreas cancer, we would use Spyglass to in anticipation of finding this and trying to get a better diagnostic accuracy. Spyglass is basically an adjunct to a procedure called an ERCP, which stands for endoscopic retrograde cholangiopancreatography, and it's a way through the mouth that we can get to the pancreas ducts and the bile duct with a scope. And in doing so, we previously had been using X-rays to inject dye into the pancreas ducts and the bile duct, and then view certain abnormalities on X-ray tests in conjunction with the endoscope. We still do that with the Spyglass, but now not only can we view it with X-rays, but we can view it with direct visualization. The Spyglass, we actually pass through the existing scope, through the ERCP scope, and then we can enter it through a channel in the scope, enter it into the bile duct and the pancreas, and then view it on a camera in real time. One of the kind of the revolutionary things about the Spyglass is it also has a channel, a microscopic channel through the scope that can allow us to pass a biopsy forceps through the spy scope and take tissue samples of pancreas cancers, of tumors of the bile duct. The treatments wouldn't necessarily be treatments for cure of the cancers, but for symptomatic benefit of the patient. The Spyglass 1 can help us maneuver around tight tumors to allow us to place wires through the tumors to get stents in place. And in the future, with this technology, I think we'll be able to provide local therapy to tight tumors, like we're already able to in benign disease, people with stones in the bile duct and pancreas duct. We can use lasers through that spy scope to kind of break up the stones. I expect for cancers down the road, we'll be able to provide local therapy to kind of shrink tumors locally in the bile duct and possibly the pancreas also.